Now let's discuss breast patient eligibility criteria. In order for a patient to be eligible for the breast project, they must meet the following criteria. First, it must be a newly diagnosed female breast cancer patient at least 18 years or older, so no male patients are included in this project. It must be a new diagnosis of either invasive breast cancer or DCIS. The patient must have had breast conserving surgery prior to radiation and will now receive whole or partial breast radiotherapy. Patients with metastatic disease are eligible if being treated to the whole breast. The treatment only can include the breast and the nodes. And number 5 is simply stating if the patient has had chemotherapy, other systemic therapy, or receiving radiation to their regional nodes, they are included in this project. Patients are excluded from the breast project if one of the following are true. Patients referred for post-mastectomy radiotherapy are excluded. Patient being treated for a chest wall reoccurrence. So again, it must be a new diagnosis of breast cancer to be included. Any other indication for radiation in a patient who has undergone a mastectomy is excluded. Patients being treated for bilateral breast cancer are excluded. And a patient will be excluded if they've had previous radiation to the thoracic region. You are only required to enroll patients who meet the eligibility criteria in the database, so anyone who has met any of these exclusion criteria will not be enrolled in the database. There's also additional inclusion and exclusion criteria listed on the patient eligibility document for your review. So this is just a brief table summarizing some additional inclusion and exclusion reasons. So I encourage you to review the patient eligibility document and familiarize yourself with all the additional inclusion and exclusion criteria.